cutting edge, timely, empowering.
Community nurses, practice nurses, remote area nurses, registered nurses working in international healthcare settings. This is a program for people who want to work in the community in Australia, anywhere, and also in international healthcare settings where practicing from a primary healthcare philosophy is critically important.
For me, probably the most important thing about primary healthcare is the philosophy or the approach underpinning it. When you look at primary healthcare, primary healthcare is really three things. In the first instance, it's a philosophy and a belief about health and about a healthcare system. Secondly, it's about a range of activities that nurses are involved with in the provision of primary healthcare. And then lastly, primary healthcare is about a strategy of reorientating your health services.
The primary healthcare program that we will introduce in 2014 is underpinned by the philosophy that has been outlined by the World Health Organization as far back as 1972. This philosophical approach to the delivery of healthcare services is concerned with ensuring equity, accessibility, affordability, with making sure that people have access to services in a way that is appropriate for them.
It's not just about where people receive care or by whom or by which healthcare professional. It is about person or people who are receiving care being in the center of the healthcare system. Primary healthcare is assisting people to make decisions so that they can actually enjoy healthy life.
This program is particularly important because we know that the burden of chronic disease in Australia is growing and will continue to grow.
Diabetes, heart disease, chronic obstructive pulmonary disease, asthma, arthritis, dementia is another aspect of chronic diseases.
This is one of the main concerns for governments who are delivering healthcare services. We know that increasingly services will need to be delivered in the community and that registered nurses have an absolutely pivotal role in the delivery of community-based services.
These conditions require long-term management, and what we are trying to do in our primary healthcare course is to ensure that nurses are cognizant of those issues around chronic conditions and also be able to support people to manage those conditions.
The program will introduce students to the philosophy and practices of primary healthcare. So students will have an opportunity to engage with that philosophy and to engage with that way of thinking about how we might work with patients and clients, particularly in the community.
Some of the core units would be around primary health care and the primary healthcare philosophy and the foundations of primary healthcare nursing. On top of that, we will build a strong evidence base, so there will be units in research and evidence-based practice. There are also a number of elective units in the program. This would enable nurses coming from very specific settings selecting units that are appropriate to their specific setting. For example, there will be a chronic disease management unit for nurses working specifically in that field. There will be an elective unit around e-health. So for nurses that are interested in expanding their research skills, they are able to take an elective unit of epidemiology and health measurement in the School of Public Health here at the University of Sydney.
Graduates from this program will have significantly developed their critical thinking skills by the end of the program. They will have further developed their leadership skills. They will have confidence in being able to manage significant programs in primary healthcare, even in very challenging and remote healthcare settings.
The primary healthcare nursing program here would be able to take a student anywhere in the world, and that you can actually take the skills that you've learned here and apply it in any local setting internationally.
We will need more nurses with the skills, the right knowledge and understanding of primary health care to provide the right care for people in the community.
You know, I think the thing for me which makes this course unique and different is the fact that there's lots of these programs in primary health care and in public health offered internationally and in Australia, but there are very few that are actually primary health care nursing programs, that are nursing programs that are developed for nurses by nurses.